obulamu bwo tobuteeka mu matigga abantu boogera bingi ku bujjanjabi tikozesa buno kozesa buli tibuwonya kino buwonya kiri manya nti buli bujjanjabi bubaako ebirungi n'ebibi.
Welcome to the 7th episode of the Health Choices program, brought to you by Makerere University College of Health Sciences.
In many health programs, people tell you what choices to make for your health. In the Health Choices program, we explain why some things that people say about treatments are trustworthy. And we explain why other things that people say about treatments are not trustworthy.
Understanding this will help you think carefully about what people say and choose for yourself what treatments are right for you.
Everywhere you go, there are people making claims about what will happen if you use different treatments. What they say is often not trustworthy.
Remember, most treatments have both good and bad effects on your health, and lots of treatments are not effective or as effective as people claim.
In this episode, two friends named Brian and Miriam are in a taxi on their way home from work and discuss a claim made by Miriam that group support treatment helps people with depression and HIV to feel better.
Brian asks how he can help his sister, who has been depressed after finding out she has HIV and AIDS. Miriam, who is a health worker, says that Brian's sister should get group support to help with the depression. She explains why her own claim is trustworthy.
Please pay close attention to Miriam's explanation.
We hope you enjoy the episode.
Hey, Miriam.
Brian.
It is good that I've found you here because I want you to advise me.
Okay, what is the problem?
My sister is struggling. You know, she has HIV/AIDS.
Yes, she told me about it, and I've seen her at the hospital sometimes.
Now, the doctor says that she also has depression. She's always very sad.
Sorry.
How can I help my sister so that she gets out of depression?
Your sister should try group support treatment. It is a type of treatment whereby people with the same problem sit together in groups and talk about their problems and find solutions to what's disturbing them with the guidance of a health worker or counselor.
Oh, how are you so sure that group support treatment helps people with depression and HIV/AIDS?
I am sure because health researchers have conducted very good scientific studies to find out the effects of group support treatment among people with HIV who are depressed.
How do they study the effects of group support treatment?
For each study, the health researchers gathered many people who had both HIV/AIDS and depression. Then they gave group support treatment to half of the people in each study. At the end of the studies, people who received group support treatment felt much better compared to those who did not get group support.
But why do you say the studies were so good?
Because there were fair scientific comparisons of treatments.
What do you mean?
In a fair comparison of treatments, the groups of people being compared should be similar before they get the treatment. The only important difference between the groups of people receiving the treatments being compared is their treatment. This way, we know that whatever differences in effects are due to the treatments they received and not differences in the people in the comparison groups. In an unfair comparison, there are other differences. Those other differences could affect the results of the study.
I think I understand. But how did they ensure that the groups to be compared were similar?
The researchers chose by chance who got the group support treatment. It is like they tossed a coin for each person. Imagine, if the coin landed on one side, the person went in a group that got the group support treatment. If the coin landed on the other side, the person went in a group that did not get the group support treatment.
Oh! You mean through choosing by chance, all the people in both groups had the same chances of either getting group support treatment or not getting it? And that no one influenced which group they would go to?
Exactly. And if everyone has the same chances of either getting the treatment or not, and the comparisons are big enough, the groups will be similar.
I now understand. So they claim that group support treatment helps HIV patients with depression is trustworthy because it was based on a fair comparison of group support treatment with no group support.
Exactly.
I think I am starting to understand it. But Miriam, will you please give me another example?
All right, Brian. Have you ever heard about ARVs?
Oh, yes. They are a type of medicine for HIV/AIDS. My sister is taking them and she's improving.
That is good because Health researchers have carefully studied the effects of ARVs in fair comparisons with large groups of people. And they found that taking the ARVs helps people with HIV/AIDS live longer.
So, in those fair comparisons, the health researchers chose by chance who got the ARVs?
Oh yes, that way, all the people in those comparisons who had HIV/AIDS had the same chances of either getting the ARVs or not getting them, irrespective of how well or unwell they were feeling.
Okay, so the groups of people being compared were very similar.
Well done. So when people who got the ARVs lived longer, the researchers could be sure that it was because of the ARVs and not because of something else.
Thank you very much. I'll make sure all my friends and family understand what you have explained so well to me.
You are welcome, Brian. I hope your sister starts to feel better soon.
The message in this episode is that fair scientific comparisons with many people in the comparison groups are the best basis for claims about the effects of treatments.
While unfair comparisons are a bad basis for claims people make about the effects of treatments.
Fair comparisons means that the groups in the comparisons are similar and the only important difference between the groups is the treatments. One of the steps that health researchers must take to make their comparisons of treatments fair is choosing by chance who gets which treatment, so the groups are similar before receiving the treatments being compared.
If the comparison is fair, we can be sure that differences in what happens to people in the different groups receiving the treatments being compared is because of the treatments. If the comparison is unfair, what health researchers find could be because of differences between people in the groups, not the treatments. In order for health researchers to be more sure about the effects of treatments, they should make fair comparisons of those treatments in large groups of people, in which one group takes the treatment and the other does not. Fair scientific comparisons with many people are the best reasons for claims about the effects of treatments.
This was the 7th episode of the Health Choices program. We hope this episode helps you make the right health choices for yourself and your family. Thank you very much for listening.
Only health research can show us the way. Ask if a health professional has done research on the treatment so that you can be more sure and make the right choices.